Let me see if I can stand in the center of the room here. I lost my voice last week, so I can't project as well. So excuse me for using the microphone here. So my talk today is professional branding and self-promotion. And I think that a lot of us have built our brand in some way, whether subconsciously or not, especially those who are in more senior positions. But I think that it's important, especially as junior faculty, to really be intentional about your professional branding and then self-promotion as well. And your image truly does matter when it comes to advancement in academics. Just a little bit of background as to why I got involved in this topic in the first place. So about a year and a half ago, one of my mentors approached me to give a talk on professional branding. And I was really surprised. And when she said, I really like the way you built your brand. And I said, what brand are you talking about? I didn't know what she was talking about. So she sat me down and kind of went through what she thought my brand was. And I was like, I guess I have been kind of living my brand. I just haven't been intentional about it. And so I put together part of this talk for that event, but then also really building on, self-promotion and why this is important for us. So no disclosures. Going through here, today's talk, I wanted to make it actually a lot of action points too. What can you do to build your brand and how to define it? A lot of these topics have been kind of mentioned over a series of talks today, which is fantastic. So hopefully we can kind of get the point across to establish your mission, characterizing your values, determining your audience, and then identifying your priorities. And then also a little bit more on self-promotion by navigating self-advertising, which can be very uncomfortable, and then utilizing social media for those who are inclined. So first I wanted to go through what is branding. So branding is really establishing a perceived image of yourself. It's what you want others to, or how you want others to view you. You want your brand to be your reputation, essentially. What are others talking or saying about you when you're not in the room? Everybody has a reputation, whether you agree with it or not. But branding, what it really does is an intentional building of your reputation. So why brand yourself? I think that for the longest time, especially through training and schooling, I just thought your hard work is really going to just speak for itself. But in actuality, branding is more than your hard work. It's really being able to represent your hard work in a way where others can recognize you. And your brand is going to allow you to do three main things. Number one, control your image. So let's say your brand is in medical education and you really want to surround yourself in initiatives in medical education. That's how you're controlling your image by really representing yourself as someone who's an expert in medical education. Then that way it'll open up other opportunities. People will associate your name with medical education, and that way it can open up more opportunities for you, such as invited talks, writing review articles, etc. Next, your brand can distinguish yourself from others. So going along medical education, what if you are just really good at developing engaging content and developing, curriculum. And so you really use your brand and really hone in on your skill set to distinguish yourself from a colleague who may be up for the same opportunity or same promotion. Lastly, your brand can help communicate your capabilities. And so by your brand, not necessarily, it's really your actions and your brand is going to be able to communicate to your colleagues, your boss, your administrators to say that you are capable and credible because your actions and your projects have been successful and you are continuing to do to really generate your brand in this way. Now, branding isn't just social media or how you know what you say about yourself. A big part of branding yourself professionally is really ingrained in your workplace. And then it can also be your brand in regional and national societies as well. And so what your brand does is that it increases your visibility within the workplace, also, nationally as well. It may open up then opportunities for you to grow within your field and then eventually lead to promotion. So it's kind of this long-term trajectory that hopefully, your brand will help you. And so that's a lot of the whys, why branding. Now I wanted to go through defining your personal brand. So we're going to go through the different kind of aspects of defining your personal brand. First is going to be establishing your mission, characterizing your identity, determining your audience, and then identifying your priorities. It doesn't have to be in this step, but of course it's gonna, you're gonna cycle back to different parts of these aspects. So first is establishing your why. We talked about this earlier in several talks too. Your why is going to be the reason why you do what you do. And you have to love what you do in order to be happy. And that's going to carry out your authenticity in your brand. And so your mission can be medical education, technology, innovation, but regardless of what it is, you should really determine what drives you to carry out your mission. This, I think, is a big topic, characterizing your identity. And this might actually go hand in hand with your mission. Um, your identity comes down to your strengths. We talked about your powers earlier, in your values. And so this was actually a chart or just kind of like an exercise that I found in several different sources about trying to characterize your identity as part of your brand. So first is your superpower. We talked about your strengths earlier. I think all of you guys have superpowers. It's just trying to sit down and really reflect what those superpowers are. Um, and then what makes you different? What everybody here is different. Everybody here has unique qualities, but what do you bring to the table that would make you unique? These are really hard questions because sometimes it's really hard to say what you're good at. I felt that when I was actually creating this about a year ago, I sat down with a couple of my peer mentors and I asked them, what are my superpowers? What makes me different? And that was really helpful. A lot of pointed out weaknesses too. These are great things that you should really know about yourself. And they may point out things that you didn't know was your superpower, and that would be really helpful overall in creating your identity. And then lastly, what are your values and passions? What really drives you? And again, comes down to then hand in hand with your mission. What drives you to, to do what you do? At the end of the day, being authentic is going to be the crux of your brand. If you are not authentic and that your brand won't seem real. In order to be authentic, you have to be genuine with what your identity is. My superpower could be that or what I think my superpower is that maybe I'd say I'm really, um, great at leading a team. But I could say that, but at the end of the day, I actually know myself. I'm actually a better team player than I am leading a team. That's something that I know of myself. I'm working on it, but it's always good to be genuine with your answers. You don't have to be all the positives. Next is determining your audience. Your audience is going to be different depending on what your mission is. It could be your colleagues, your boss, trainees or mentees, administrators, patients, industry, depending on what you want your mission to be. So whether it's quality initiatives, whether it's patient education, whether it's working with industry, your brand is going to be different, and you have to tailor your brand to that audience if you want to be an effective leader. Lastly, and I think this is the hard part, is identifying your priorities. Now, you're all here because you probably have fantastic superpowers. You love to do a lot of different things and you're probably great at multitasking, but your brand needs to be consistent. And so identifying what's important to you first can be your, initial brand. Things can change down the line, but you definitely want to be focused initially. So just those are kind of, it seems very abstract so far. Hopefully there's some my action items in there, but I wanted to just briefly go over my journey of creating my brand actually when I started doing more research into this, more intentionally creating my brand or my reputation. So about before, during training and schooling, huge victim of not setting priorities. I said yes to everything. I did medical education. I did technology stuff. Academic journals, patient advocacy. I said yes to everything and I loved it. It was great because I got these opportunities along the way as a trainee, but I realized this is not sustainable. And then at the end of the day, personally, I wanted a niche of my own. So about a year ago, I sat down and I really tried to reflect on what my brand is and how I wanted others to portray or how others see me, how I wanted to portray myself. Also, again, rooted on what I've done so far. And so I decided that my mission is going to be more focused on technology innovation and working with industry for clinical trials. Now, that was a year ago. And doing that research, I had realized that there are 0 female PIs in industry and technology innovation in my field. So because of that, seeking out stakeholders, trying to realize that this is a lofty mission. But I think that hopefully there will be some in the next few years. But that was my mission because my values laid in decreasing the gender gap within my field, within, specifically overall medicine, but my field, especially with interventional endoscopy, there were 10% of us practicing when I had started my training. We're up to 18%. So we're getting there slowly but surely, but that was part of one of my passions. The next was technology innovation. I really enjoy working with new devices and then developing devices ergonomically for female hands in a very male-dominated field. So that was part of it. And then my audience. Part of my audience is going to be current clinical PIs who tend to be males and appealing to them, finding other female stakeholders, and then talking to industry. And so really and industry also within our tech world is very male dominated too. So finding those who are also interested. So those were my audience. And so since then, over this year, I've been able to then also, because I knew what I wanted to do, I've been intentionally then reaching out to these stakeholders and setting up meetings. And so that's kind of how I've been building my brand, even though this is saying this is what I want to do, but then also putting in the legwork. And then also by doing that, it's kind of perpetuating my brand as well. So a lot of this takes time. It's going to change over time too, because your values are going to change over time, and that's okay. Now, in order for your brand to work, there are principles behind personal branding. We call it the 3 C's. The first is clarity. Your message in your personal branding needs to be clear. It needs to, it, it just needs to say, and a lot of people actually have their mission, their personal mission written out, and that could be very helpful, something that you can refer back to and say that this is my mission so that you can come back to it and be clear and concise on what you want your personal brand to say. Next is cohesiveness. All of your branding needs to be the same across. I could say that this is what I want to do. This was my mission, and this is my brand. But in actuality, I don't actually work with very many new devices. If I don't actually end up working with industry, then my brand isn't very credible. There's going to be a disconnect between what I say my brand is and what my actions truly are. So if there is a disconnect, then your brand isn't going to really work for you. And so at the end of the day, also content. So then this kind of brings back what your actions are. Your projects, your initiatives should revolve around your mission. And then that way you kind of build your personal branding in that as well. So again, these 3 C's create credibility in your branding. So now that we've all developed our personal brand, next is I'm going to switch gears over a little bit on self-promotion. And this is an uncomfortable, I think, uncomfortable topic for a lot of people, myself included. Self-promotion, I think, a lot of people who are in the disc of, very dominant feel or area personalities may become easier than for those who are not. And so self-promotion, I think, is positioning yourself for opportunities and promotion. Just being able to truly highlight your accomplishments so that others can recognize you for the hard work that you've been doing. This is a statement of fact. Women are less likely to self-promote than men. There are a lot of studies out there that show that it's changing. And it's increasing in the women area, but we still have a lot of ways to go. And the main study that a lot of these areas of actually quote, there was one experiment that they did where they gave a test, a math and science test to a large group of adults. And after they took the test, these men and women were asked to rate themselves from 1 to 100 and say, how well do you think you did? The men rated themselves 61 out of 100, while the women rated themselves 46 out of 100. So we think, why is that? And the conclusion of the study at that time, this was done in like the 80s, was that maybe men are just more confident. There are other studies out there that maybe say that women are less likely to self-promote because of normative gender norms, because we women are more family-centered, community-centered, and men are more self-centered. Again, these are, theories that were put out in like the 90s and 2000s. Things are changing. And the biggest part also is that they is that self-promotion requires not only the confidence, but also a network as well. So then hopefully things are changing for the better. This is actually a great group that I found online who are aiming to reduce the self-promotion gap. And this was interesting. They did a survey of women and they found that 77% of women find that it is very unpleasant to talk about themselves in a room full of strangers. And 47% said that they would rather run errands in the rain. 42% said they'd rather clean the bathroom. And 43% said they'd rather give up social media for a week. So it's really hard for a lot of women to talk about themselves. And so the group is trying to reduce this. And I think that it's important to be able to feel comfortable talking about yourself in the in general, but also especially in the workplace, as well as with with people who are going to be giving you opportunities to advance in your careers. Now, I am going to talk about something that might be controversial, and maybe you might disagree with me, and I'm okay with that. So I think that self-promotion is a double-edged sword. The question is the world ready for women to self-promote the way men do? And I don't think the world is ready. I think we're getting there. But there is a study that was published that talked about how women who self-initiate negotiations were perceived more negatively than men who self-initiated negotiations. I'm not saying you shouldn't. I'm just saying that unfortunately, the fact is there that it can happen. And so there are people out there and who think that by self-promoting, you may be, shooting yourself in the foot. Now, there is a way to self-promote, and that's a lot of, the way that, we talk about tips on self-promoting instead of trying not to come across aggressive, trying not, these terms that people tend to label women, but not men when they're saying the exact same thing. That's an issue, unfortunately, that we do deal with. And I know we had some questions earlier on, and a lot of people do say, just deal with it, and it's okay to come across as aggressive. And I think that that's okay too, but not every female is the same. We don't all feel comfortable that way. We can keep practicing it, but I can say as a junior faculty, I don't feel comfortable yet doing that. And so these were some tips on self-promotion that I found on the Harvard Professional Executive Development website, as well as some other business-focused self-promotion for tips for both females or women as well as men too, but just being more specific. It's hard to say, I am going to be really good at this project, you should give it to me. It's hard to say that. So stick to the facts. Sometimes you could just then state, I have accomplished this, A, B, C, and then you can end with, this is why I will be good at this project. But sometimes you need that, stick to the facts. Talk about what you've accomplished so far. Use I statements. So this is in relation to promoting yourself and saying why you deserve this opportunity. The I statement is unique because women tend to say when receiving, a compliment or an award, we did a really good job. Our team worked really hard. But what you really should also be acknowledging is that I worked really hard and I deserve this award as well. And so use I statements when you're talking about your accomplishments. I think that women tend to disperse the credit a little bit too much. It's always good to give credit, but we tend to do it a little bit more than our male colleagues. Sometimes it's hard to self-promote, so to say what you are really good at. So think about yourself in the third person or sit down with a colleague to say, and ask their feedback on what you what they think your strengths are, like what we talked about earlier. And again, don't minimize your achievements, going back to the I statements. And it was mentioned in the talk before too. Your achievements are your own and you worked really hard to do it. Please don't minimize it. Kind of jumping a little bit on a different topic of self-promotion is basically if you're up for an opportunity, find a common ground with a person who's offering that opportunity. So let's say for example, I had recently, encountered had an encounter where a industry rep said something to me that was extremely sexist. And I had then ended up talking to his boss, who was female, and finding a common ground of, how did she get to where she was? How did she become a boss in this industry field? How can we train our reps to talk to females because they're not used to talking to females in my field? And so trying to find a common ground and then finding that opportunity then to insert myself in that industry and say, hey, I think that our field is growing in women and we need to really talk about how the devices are not made for our hands. We need to talk about innovating and really changing. So that was kind of my in, but finding a common ground in trying to find yourself opportunities. in projects, in at least opportunities, seeking a high profile project that could be anxiety provoking, but these are ways to really make yourself at least more visible. Enlist allies. There are lots of he for she's out there, and they are going to be the ones who potentially put you up for an opportunity, and they may, open doors for you. Build a network of both males and females. Now, building this network may just mean, as we had mentioned earlier before, just having someone on your side during that meeting to say, yes, I think that, Sarah made a great point earlier, and I think that we should try this initiative. Again, be confident and be visible. These things are just a little bit, less tips, but more of just like practice to try and be more confident and be more visible during the meetings, even if it just means some self-affirmation in the mirror right before. Now, social media, of course, is growing more and more. I think that social media has its pros and cons, but I think that actually its self-promotion in social media is growing and people are getting their academic advancements because of it. There are lots of platforms out there. Making sure that your brand and the way you self-promote on these platforms, it's forever on the internet, whatever you post, that makes sure it aligns with your brand. Now, this is actually interesting. The reason, things I'm bringing up is why these things matter. So this was actually a study that was done recently that they showed that tweeting actually increased citations and in academic journals. And so the way they did this was that they did a randomized trial of selecting an article and then tweeting it and then comparing it to a control that was not tweeted. And so they saw that the citations and the altmetric scores actually were significantly higher amongst articles that were tweeted. And they even controlled that by the journal type and then the age of the article. And it shows that citations can increase with tweeting. And then harnessing social media for academic promotion and tenure. This is 2016. Mayo actually introduced this as part of their academic promotion and tenure. And so they're using this as a criteria for promotion amongst some of their clinician educators. Just going through this, the criteria for being or for using social media in your academic promotion, if you actually kind of read the criteria, it's really your professional branding then harnessed in a way that would get you an academic promotion. But in all of this, being in social media, be responsible, especially those who are in patient care. Privacy check is so incredibly important. You do not want to be exposing any of your patient information out there. And I think that was a big issue first when social media took off in the academic field. Privacy check, double check, triple check. Make sure that none of your patient's information can be, tied to your post. And this I felt was a very great chart of just how to make sure that that you de-identify the best as possible. And some things you don't really think about. Like avoid saying, today I saw a rare case of this. I mean, people dig enough, they're going to know what case that is. So things to really avoid if you do have to post anything identifying on social media, ensure that the patient consents to it. And even then, make sure that you abide by institutional guidelines as well. And I think WashU definitely has that. So lastly, just some take-home points. Building your brand includes just determining your mission, your values, your audience, and your priorities. This is going to change, again, as your values change over time. As you get more opportunities in advance, you may alter your brand a little bit, but just something to keep in mind is that if you alter, annually, it might be a little bit too, you just want to be as consistent as possible with your underlying brand. my opinion that self-promotion can be a double-edged sword currently. I hope in the landscape, future landscape, that this can change and will change. But it's very crucial to your visibility. So a big part that we talked about throughout the talks earlier is just practice. And sometimes, you know, practicing and also engaging your mentors on how to respond or how to like state something in terms of self-promotion might be useful. I have some mentors that are more extroverted and they tell me you should say this. And then I can't imagine myself ever saying that statement. And so I had, I would practice it or maybe tone it in a way that then reflects my personality a little bit more. So your image matters, regardless of whether or not you built it yourself or not, but hopefully after this talk, you kind of be a little bit more intentional a little bit about your reputation. Thank you.
Great. I think we have time for some questions. One thing that I wanted to say, kind of adding on to that, and I'm not someone who loves to self-promote, and I'm not someone who loves social media. However, I recognize the value in it. And what I found is that if I tweet an article that my postdoc was first author on, it really helps her. And she loves it because it gets a lot of attention, gets some it's more traction. So I feel like sometimes with social media, if you can almost have a buddy that kind of, you have an arrangement, or a group of people that say, okay, can you post this and I'll post about you? Because it's always easier for me to post about other people than about myself. But if I feel like my postdoc can benefit from me posting about a paper, then it's, I don't know, kind of overcomes that initial sort of ick factor I have with social media and self-promotion.
Yes, absolutely. That's your network. So I think, I will go back to that, but I think there's a spectrum of social media. Like you don't have to be an original content producer. You don't have to do original dances on TikTok. Like that's not me, and it's some people and that's fantastic. I am more of a passive social media person. I like to promote other people's work. I love to promote like other people's studies that I think that are clinically impactful. So I'm more passive in that case. But that's part of my brand. I promote other people's like academic work that I think can be cutting edge and that can impact my daily practice. And then finding your network. So when I first started on Twitter X, my colleague who is, huge in it now, but at the same time, he was starting it off too. We would actually text each other and say, hey, I have this great opportunity to like speak at this. Can you like live tweet it for me? We would just say it to each other. And then, you could have somebody else promoting your work without saying, and I think that is more of my comfort zone. And that's why I was able to do that. But find your comfort zone. I think each person's different and then find what works for you. I love that idea. It was actually something that I had been reading before about implicit bias training. There are a lot of trainings out there now, and I think that when I was in GI fellowship, when I was a chief fellow, we actually made all of our faculty that year, and my program director recognized it, to do implicit bias training before we did interviews for GI fellows. And I thought that was really important. I think that's something on an institutional level to do at a higher, administrative levels in order to do that, because I think that that's really important. It's not enough just to watch a PowerPoint to say like, yes, you have implicit bias. But I think these workshops become very useful because it really engages your personal beliefs. What you didn't think was a bias truly is the bias. And it takes a lot of open minds to do that. Unfortunately, when you have these like open workshops where people who go to these workshops are those who probably already kind of most aware of their implicit biases. So what we are trying to do is engage those who don't typically attend these workshops. So I think that's really important. Thank you.
Thank you so much.